Well, hello, everybody. Welcome to our Start or Sit podcast here, going into week 15. Dr. Hawkins, how you doing?
I'm doing great. Not quite loving the long nights. We need to start turning the corner and getting some daylight going.
That's December 21st. That's when we start.
Exactly.
We're close. We're getting there. We're close. I read something the other day. The Christmas tree tradition actually started by bringing a Christmas tree into your house because of the cold, dark nights and days in December. It kind of indicated the green is out there. The spring is around the corner. So I thought I read that's where the Christmas tree tradition came from. A little tidbit there for your trivia night, okay?
I love it. I love it.
Yeah. Hey, before we get started, I would be remiss if I didn't take an opportunity here just to give a shout out to Coach Mike Leach and his family and all the players and everybody that encountered Coach Leach over the years that he coached in college football. Amazing guy. He coached at my alma mater there at Washington State University, turned that program around. Very, very interesting guy. Extraordinary mind. He's one of those coaches that never played football. He's like one of five. So R.I.P. Coach Leach. How about that? Okay.
Yeah, definitely.
Yeah. So here we go. Kyler Murray. Boy, this guy, I'm not sure he's played much this season. He seems to have been hampered by injuries previously, but he had an extensive injury the other night when they played. It looks like he is facing a season-ending ACL injury. Is that correct?
Yeah, exactly. Most people have probably seen the video. He kind of was in the open field, kind of doing a little bit of sort of like a head fake, tried to do a little bit of a weave, and you could just see he kind of had his right knee give out on him. So it looked like sort of that classic non-contact ligament injury to his knee where, the change of pace, change of direction, you're trying to decelerate. So, the ACL is one of those big major ligaments in the knee, large rope that goes bone to bone from the femur to the tibia in the middle, and it helps to control that rotation or stop that rotation between those two bones from going too far. So unfortunately, that's the injury that he had, and that will be, that'll be surgery with a reconstruction. He will need, essentially a new ligament hooked up, new rope hooked up from point A to point B in his knee, and we'll be looking at a pretty extensive recovery. Obviously, there's a good track record on those. Yeah. And he will be back. It's always that question of, okay, first, when he comes back, will he be the same type of player? And oftentimes for mobility, that takes almost 12 to 18 months to really start to regain that.
Yeah. You're looking at 12 months at least. So he's out the rest of the season and probably a good majority of the next season as he rehabs that ACL reconstruction. But the good news is, like you just mentioned, this technique in the advanced surgical interventions, the minimally invasive surgery with these ACLs, they've come a long way. And isn't it? Don't we have someone like Saquon Barkley? Didn't he have an ACL like 2 years ago? And he's performing pretty well. So opportunities there. So
yeah, and that's exactly why that's that whole thing. He'll be back in a year, but it might be that second year to really see if he returns to the type of player that he's been so far. But some people might say, hey, it'll make him a better quarterback because he'll learn how to rely on his decision making and his choices instead of just taking off running when things break down. Yeah,
good stuff. Tyreek Hill, Miami Dolphins, wide receiver. Here's the deal. I watched that game the other night. Man, Justin Herbert, he went off. Game of a lifetime for him. Chargers, depleted defense. I mean, they have a lot of key players injured on defense, and they held their own, and they beat the Miami Dolphins. But Tyreek Hill was in and out, particularly the third and fourth quarter. I watched on the sidelines. It looked like they were icing his ankle, but it looked like they were icing more in the mid-calf area. And it sounds like it's kind of a soft tissue injury. What do we know about Tyreek Hill?
Yeah, we definitely know that it's not a major structural injury. Just like you said, they were sort of doing their best to kind of manage it from a soft tissue standpoint, icing it. They were doing some things with kind of moving him a little bit on the exercise bike to keep him warm. And I think it was just one of those things where it was just hampering his ability to do things quickly and move quickly. And that's why I think you saw him kind of have decreased playing time as the game went on. But they've been pretty clear that it looks like structurally he's fine. So I think coming into this week, I think he'll be one of those game time decisions. They'll see if he warms up. And so I think he will be somebody who will play, but I think he, unfortunately, with a little bit of a short week, and because I believe there's a Saturday game this weekend, we get into the Saturday games.
That's right. That's right.
Yeah, I think he's going to, maybe be not as productive, but his productivity is usually so high. If people have him in fantasy, they still might want to use him.
Yeah. I think he's going to play. I think I would agree. I think he's most likely a play, but probably keep an eye on him, see how he does in warm-ups, etc., and the rest of the week here. Deebo Samuel, San Francisco 49ers running back, all-utility player. I mean, he was carted off the field, so this is an extensive injury. I think they said the ankle is not broken, but most likely a significant, we talked about this before, kind of one of those high ankle injuries. We've seen a lot of those this season. My gosh.
Yeah, his injury, he got that classic when he was tackled. Somebody was on his lower body, and then he sort of got bent backwards and sort of had that rotational injury. We've talked before about how when your foot gets rotated, it starts to kind of put pressure on separating those two bones in the lower leg, the tibia and the fibula. He also, as part of that, the injury kind of got up to his knee level as well. So the good news in all this is it sounds as though he went through what all these NFL players do. He got evaluated, got imaging done, and they do not see a significant injury to that syndesmosis. So they don't think it's a true, bad high ankle injury that's like kept, say, Mike Williams out for like 6 or 8 weeks this year. So it's being classified currently as sort of a grade 1 MCL injury at the knee. So that ligament at the knee got sprained or stretched, and then sort of a high ankle sprain without that structural damage. So now they're talking it back a little bit, like it might be a 3 or 4 week thing, but he will definitely be a sit, no surgery, so he won't be out an extended amount of time.
Yeah, so Deebo Samuel, San Francisco 49ers, is a sit this week and possibly, like you said, maybe 2 to 3 weeks as that tissue heals. San Francisco, man, talk about a team that's on fire, huh? Are they? I think the Seahawks have them this week. I think we have them on a Thursday night game this week, and we're still in the hunt there. The Seahawks are in the hunt, but we're losing steam, so to speak. Mike White, this guy, quarterback, New York Jets, man, he just got hammered. I saw a couple hits on him. I mean, it looked like his rib cage, I should say, took a couple direct shots. That's what they're calling it, a rib injury. And I don't know. Rib injuries are pretty tough. Is he going to play?
Yeah, we've used that analogy before that, your rib cage sort of, provides, it's kind of like a barrel. It kind of has a support to it that is held in place by your ribs, helps protect the lungs. But when you get these injuries and it requires you to tighten up and to control your core, it's very, very painful. We've seen it a ton in quarterbacks. So, he's a tough guy. He's a guy who's had to work hard to get into this position. I think he's going to play. He'll be out there probably with one of those flak jackets that's going to make him look like a sumo wrestler, around the middle. And he'll try to get out there and throw and play. And they really don't have a good option behind him.
Yeah.
When Flacco came in, he looked like he did not want to be there anymore. He looked like he wanted to retire.
I don't blame him. That's the Buffalo Bills. They're pretty tough. I mean,
yeah, exactly.
There was some.
So I think Mike will be a play this week. They showed that he didn't have any fractures on his imaging, so it's a soft tissue injury. That is one of those ones where occasionally they will do an injection before the game if he's got a real sore area, and kind of numb it up to try to get him through the game.
Well, that's, speaking of rib injury, I mean, didn't Justin Herbert have some kind of rib cartilage injury early in the season? And he's just now, he looks like he's now comfortable again. And that was like 6-7 weeks ago. So it can take some time. These injuries can take time. Again, we talked about this. It's biology. But the rib cage, unlike other parts of your body, it's pretty hard to immobilize or brace that or give it any kind of protection, with the exception of flak jacket. But, you get a hit there again in the game. I mean, it's going to exacerbate that pretty quick. So keep an eye on Mike White, QB, but he's going to play most likely. Good stuff here. Speaking of good stuff, these guys seem to be getting some traction here. That's the Cincinnati Bengals. But they've got this Tyler Boyd, wide receiver. He's got a fracture, dislocation of his finger, and it sounds like it might be a surgical intervention just to get that bone. Maybe it's displaced. I don't know. What do you know about Tyler Boyd?
Yeah. So they've been a little back and forth on his information. I mean, he definitely had a dislocation, probably a PIP dislocation. So that's it's sort of in your finger. It's the close knuckle in your finger. And so that's kind of it's typically a hyperextension injury. And so what happens is the middle phalanx, the middle bone in your finger, dislocates to the back or the top of your hand. And that it tears something called the volar plate, which is some thick tissue on the bottom, and then you can have damage to the collateral ligaments, which are kind of like the MCL and the lateral collateral ligament in your knee. So they're the ligaments on the side. So he got it reduced there, and they're talking about a 3-week return, which, again, tells us it's probably more than just a simple dislocation. I think he's probably getting a few different opinions about it. A lot of times there's a small avulsion of bone associated with those. And so sometimes if that little piece of bone is large enough, there's the question of, would it heal better by putting something in there to hold it? And that's probably the discussion about whether it's surgical. So he's definitely not going to be sitting this week. I think the goal is about a 3-week return. The simple ones oftentimes just get taped and guys return to play pretty quickly. So the fact that they're talking a few weeks points out what you just said, that there may be a small fracture associated with this.
Yeah, and for our listeners out there, when we talk about a dislocation, there's extents of dislocation. I mean, sometimes it's a minimal subluxation or it's a significant subluxation dislocation. When it's significant, like you described, it tears all that connective tissue, all those ligaments around that joint, the capsule, a lot of soft tissue damage, and then, like you said, maybe an avulsion fracture. But he's out this week and maybe for 2 or 3 weeks with the finger injury. Let's talk about Jeff Wilson Jr. This guy was having a good game, and then I saw, I don't know, it was like third quarter or something like that, maybe the end of the second quarter. I think he was on a cart going off the field or walking off the field into the locker room, and they talked like he had a hip injury. So what do we know about Jeff Wilson Jr.?
Yeah, another one of those situations where, he got torqued or twisted. And in this case, it was sort of between, the middle part of his leg and his upper body. And so I think they were a bit concerned taking him off as far as the extent of the injury. He, again, had some imaging done. So it does not look like he had any major structural damage like a labral tear or anything else in the hip. So he looks like it's that sort of soft tissue injury, those short supporting muscles that cross the hip joint, perhaps a little bit of his hip flexor as well. He seems to be in treatment and kind of a day-to-day decision. I think, again, they're pretty banged up. Like you just said, they've got a big game on a short week.
Yep.
So I think I would look at him sitting, but I think he is going to return relatively quickly. I think the following week he'll probably be back. They've got a lot of small nicked up injuries, and they're gonna be fighting to try to stay in, and obviously the Seahawks are going to be trying to hunt them down.
Yeah, exactly. Well, there you go. That's week 15 or going into week 15. Players that will either start or sit in your fantasy football league. Keep an eye on them. Dr. Hawkins, again, thank you for your time. Always great chatting with you, and have a great day.
I appreciate it, Shannon. You too.
Okay, we'll see you. Bye now.